Hello, everybody. Good morning. We are Group 6. My name's Jack, and we're here along with Ashley, Devyn, Luis, and Cesar. Our research topic was on public space. COVID-19 caused a huge disruption in social interaction and completely changed the way our society used these public spaces. It slowly drove social environments to become smaller and more isolated, and thus it disconnected the community on a local and a regional level.
Public space is an example of human geography because public space deals with humans and the relations of their communities, cultures, and economies, as well as human interaction with their environment. Urban geography is a subdiscipline of human geography that fits our research by helping us understand and analyze the communities of cities and landscape that we can interpret from public space. By using the research we conducted from our class interviews, we see a theme of sense of place, in place and out of place, and spatial diffusion. These human geographic concepts are important to our research because we observe how people use the public space by describing what it is like to be at the place they go to. Also, we notice a dramatic change take from public space by the spatial diffusion of COVID that has spread worldwide from place to place. Lastly, the kinds of location people go to are majority in place or out of place, whether it is a privately owned space or a publicly owned space. These are the three research questions that we picked. 1. How and why do people use the public space? 2. How has COVID changed our use of public space? And 3. What kinds of locations are public space? The goal of our research is to analyze the social interaction within the different locations of public space and how COVID changed the way we use public space before and after COVID.
For our literature review, we found 3 empirical research articles. The first one is "In Everyday Geographies of Belonging, Syrian Refugee Experiences in the Northern Netherlands." Huizinga and Van Hoven conduct walking interviews with Syrian refugees to record their sense of belonging and in and out of place. Walking interviews allowed observers to participate in the refugees' daily lives while still asking semi-constructed questions. Huizinga and Van Hoven focus on how the refugees use public space, their neighborhoods, to gain a sense of belonging in a new country. What they found was that social interaction with neighbors helped refugees build a sense of belonging to a place. Also, public space such as Turkish supermarkets, parks, and community centers aided refugees' sense of place. However, refugees still fell out of place due to the Netherlands government regulations, which slowed their process of naturalization. New to the Dutch language and culture, refugees struggled to socially interact in everyday life and public space.
In order to combat the spread of COVID-19, restrictions have been placed around the world on the use of public spaces to protect the public's health. In the article Impacts of COVID-19 Pandemic on Urban Park Visitations, a Global Analysis, authors Dehui Gang, John Ines, Wanli Wu, and Guangyu Wang explore the impacts COVID-19 has had on public spaces, as well as government response policies on park visitations. The author found that restrictions on social gatherings, closure of malls, schools, workplaces, restaurants, and other social activities has increased popularity of parks. A park's role in public health and well-being has caused their popularity to rise even in times of a pandemic. In the article, parks are not only community parks, but also public gardens, plazas, dog parks, national parks, beaches, marinas, and as well as other outdoor places. And pandemic-driven stressors such as self-isolation, health-related issues, exposure to negative news, financial and food insecurity has resulted in negative psychological effects, leaving people to deal with high levels of stress, loneliness, depression, anxiety, and more. And since access to social activities has been restricted, people have been using parks and other green spaces to improve their mental and physical well-being. The author says that according to Google COVID-19 community mobility reports, park visitor numbers in most countries initially decreased before eventually increasing and finally reaching levels equal or even higher to than a baseline taken as a mean value of daily park visitors between January 3rd and February 6, 2020. The authors concluded that visitation to the parks increased when public policies began restricting social and physical contact. In the article, the impact of COVID-19 on public space, a review of emerging questions, author Jordy Honey examines public spaces, how we use them, and changes that we may see to public space design post-COVID. The author provides examples of public spaces throughout history that have been used by the public to organize, form groups, and engage with the community politically. Such places include the Zocalo in Mexico City, Tiananmen in Beijing, Maran in Kyiv, Tahrir in Cairo, and Gezi Park in Istanbul. While it isn't clear how COVID will change our public spaces, Honey believes that now urban planners will have to shift their focus towards designing spaces that promote improving public health. The author argues that widening sidewalk and reducing street space will not only make more space for pedestrians and cyclists, but also reduce carbon emissions. While it is unsure what responses cities will have to public spaces after the pandemic, COVID has shown the importance of public spaces are to a city. During the pandemic, large public spaces had been transformed to address public health emergencies, like being used as emergency field hospitals as well as shelters.
Interviews are a method of data collection that is very valuable in the sense that it allows us to gain more in-depth knowledge on a subject or place that quantitative data simply cannot. Asking open-ended questions as well as follow-up questions give the interviewer a chance to gain even more information, and also gives the interviewee an opportunity to not only describe what they are seeing, but discuss the emotions they feel about the subject. The biggest problem with interviews is the lack of anonymity, so it is important to inform the interviewees that it is completely anonymous and that they can stop the interview whenever they want and don't have to answer any of the questions they don't want to. Because we're interviewing our own geopals, the anonymous part might not be true, but there's nothing we can do about that. The data collected for this project was conducted through interviews of geopals, where the interviewees were asked questions on what public spaces they use in their daily lives, how they use them before COVID-19, and how they use them after. In order to analyze the information gathered, categories were created to help organize and code the responses. After evaluating all of the coded interviews, we found themes that seem to be repeated in most of them. Responses mainly focus on cultural activities, health and safety measures, social interactions, and emotions. Cultural activities mostly took place in public parks and beaches where people said they played soccer, basketball, rode bikes, or even simply just went for a walk or run. These are activities that some usually did alone, but many said they used to do with a group of people, which all changed when COVID-19 hit. A significant number of people mentioned in their answers that they now wear masks when going out and about in parks or any public space where they know they are going to be around other people, and usually try to avoid coming into contact with anyone else. Many of the activities they once took part in before COVID-19, they no longer do because it would require them to be around other people, or simply the facilities have been closed or shut down. Emotions play a big part in people's lives after COVID-19 hit, because the things they used to do carefree without a second thought now feel worried and anxious when they go outside or have to interact with strangers.
So these are the before COVID-19 results. Before the pandemic, people's sense of place revolved heavily around the use of public space. Public space plays an important role in one's mental and physical health, along with social well-being. It serves as a place for people to interact with each other while participating in cultural and economic activities. A person's sense of belonging can also be affected by their use of public space, such as Huizinga and Van Hoven's research on Syrian refugees in the Netherlands. Ultimately, public space influences our sense of place, becoming a large factor in our everyday life. Specifically within the study, public space played a huge role in one's social interaction with friends, but also strangers and other users of public space. The majority of social interaction involved using public space as a meetup spot to converse and hang out with friends. One interviewee, a 20-year-old Caucasian male, explained that he used parks to have social gatherings with friends for hours on end, to catch up and talk. Interviewers also used public spaces to participate in cultural activities such as playing basketball, skating, riding bikes, and walking around shopping centers, often with friends. They also interacted with strangers, making small talk or including them in their activities. In his interview, a 23-year-old Caucasian Asian male stated that he used his local recreation center to play basketball with everyone from all around the community. Before COVID, people seemed to be more friendly and willing to interact with strangers. Huizinga and Van Hoven see a similar interaction with their walking interviews, as Syrian refugees greet neighbors or make small talk with people. Out of the 21 interviews, the most occurring place tended to be parks and beaches, which are publicly owned places, making them easy to access by anyone. Besides parks and beaches, people visited grocery stores frequently with family members without worrying about crowding or long lines. To add, restaurants seem to attract a large amount of social interaction, as interviewees recall using them to meet friends or go out and eat with their family. One respondent, a Black, Ethiopian, Eritrean American single heterosexual 22-year-old female, explained that she would go to the grocery store every week while also eating at her restaurants with her family and her friends frequently. In this case, most privately owned public spaces were used to participate in economic activities, such as buying groceries or eating out. Yet publicly owned public places still remain the most visited place by our interviews in regards to socially interacting with friends.
As the pandemic continued to spread, many adjustments had to be made to our way of life. Prior to the outbreak, we lived our lives with little to no worry. Now it seems that every decision we make, we have to do it so carefully. COVID-19 has dramatically impacted our public space as we knew it to be. It was once a way for society to connect and gather to share similar ideas and/or beliefs. The environment we used to have curate a sense of place for many individuals. The spread of the pandemic has forced our political leaders to enforce safety regulations that have the best intentions for the people. However, these protocols have not been easily accepted by many, thus causing the virus to spread even further. In order to manage this pandemic, we have to take social responsibility into our own hands. Following simple protocols such as frequently washing our hands, wearing a face mask, and social distancing goes a long way. Throughout the interviews, there is an occurring theme after COVID. A majority of interviewees either avoid the public space they visit or follow health guidelines. Those who go to privately owned space only go for essential business. One participant stated that he is taking a break from all the madness of the world to distress from the week's wildness and just to sit in the sand and meditate. As of now, we are slowly adapting to new rules and regulations that have affected our previous way of socializing. There has not been much interaction involved economically or culturally. Society as a whole seeks to socialize. It is important that we have human contact and social interaction. We have lost touch with our sense of place, and who knows what the future holds. We have provided a chart where 21 of the interviewees have gone to a public or privately owned space. The private space list is a bit longer because these were more specific places than a public space where it was more general. We can also see the effects of before COVID, how people interacted with public or privately owned spaces versus after COVID on how they changed the way they used the public or private space.
So, COVID has changed a lot of the way our society interacts in public spaces, involving our cultural activities, our health and safety measures, and our social interactions. Basically, cultural activities have slowed down at a huge rate because of the attempt to minimize social gatherings. Because of the health and safety measures and the increase in protocols, it's caused an increase in social stress levels and anxiety and led to a more isolated society. For social interactions, they've become a lot more stagnant, a lot more stationary. People aren't moving around as much in terms of local location. There's also a heavier focus on interdependent social groupings of family and close friends rather than community-based groupings of friends and friends of friends or friends of colleagues and so on. Overall, we noticed that people are becoming a lot more in touch with their emotions, either good or bad. But overall, that's what we noticed. A lot of them, practicing acts of self-care, and we had a specific example of people, learning how to meditate and taking more time for themselves. Overall, in a society where we used to warmly approach one another, now we avoid them in line and live in fear of one another. COVID has had many impacts on all human beings individually and has effectively disrupted the power and momentum that drove our social institutions. Although this year has been taking the world completely by surprise, I'm not afraid of the resilience of our world, and I believe that we will get over this pandemic and reunite, becoming more connected than ever before.